Member for Higgins.
Thank you, Mr Speaker. As the world watches the carnage from the COVID pandemic unfold around the world, my constituents in Higgins have told me they are pleased and glad to be in Australia. And they're pleased and glad because they have felt that as Australians we have worked together to carve our own curve and to ensure we have dodged the bullet that is the coronavirus pandemic. There's been so many important things that have been done to make sure that the health of all Australians are kept front and centre as our government deliberates in a bipartisan way by working with the National Cabinet to close our borders, to enforce strict quarantine for people visiting from overseas or arriving home from overseas, to insisting that people practice social distancing. It has had a profound effect on so many Australians, whether it's been Australians who have not been able to have the wedding that they wish they could have, whether it's been Australians who have not been able to mark the occasion of the passing of a relative and friend, whether it's been an Australian who has lost a job, an Australian who has lost their business. There are so many impacts that are broad and general and sweeping from COVID that Australia has managed to deal with quietly. But there is one impact that Australians know is having a deep and long-term impact, and that is the indirect effect of COVID on the mental health of all Australians. Many have suffered in silence. Many have dealt with tragedies that they have not been able to share because it's not just them that is hurting, it is their family that is hurting, it is their communities hurting, it is their country that is hurting, it is the whole world that is hurting. But Australians can feel that there is support coming from their community and from their government because the Morrison government has committed to not only understanding, acknowledging, but delivering on the two aspects of COVID. Firstly, the health aspect, which we've all heard about, but secondly is the mental health aspect. And I'm proud to be part of a government that is putting this at the front and centre of its response to a pandemic crisis that is causing carnage around the world. On Sunday, the Morrison government announced a further investment in mental health services across Australia. $24.5 million will reduce wait times and fast-track access to mental health services at Headspace. We know that 1 in 4 young Australians are affected by mental health. In my electorate of Higgins, the government is delivering on its election commitment to deliver a Headspace in Glen Iris to support the young people of Higgins and surrounding areas. It aims to improve access for young people aged 12 to 25 who are at risk of mental health. And it offers early intervention services in key 4 areas: mental health, related physical health, social and vocational support, and alcohol and other drug use. But Headspace is just part of a large suite of commitments for mental health services and support, which is estimated this year to be $5.2 billion. This includes an additional $500 million for mental health services and support, $64 million for suicide prevention, $74 million for preventative mental health services in response to COVID, and $48 million to support the pandemic response plan. The Morrison government is also investing $4 million into a range of projects to improve health outcomes for some of Australia's culturally diverse Australians. The funding to be provided through the National Women's Health Strategy, National Men's Strategy and the Child and Youth Health Grants will particularly assist Aboriginal and Torres Strait Islander people and people from culturally and linguistically diverse backgrounds. As Australians, we know that the carnage is global, but we do know that by working together and by supporting each other, we will come through this. It is imperative that in our economic response, we put jobs at the centre of what we do. Because by having a job and having the dignity of job, it provides the opportunity for young Australians to have the hope going forward of a prosperous future that hopefully is both healthy and safe. As we begin to unlock Australia, the government's National Mental Health Plan will be the key to ensuring the economic prosperity of getting us back on track. Thank you, Mr Speaker.